After 60, we all forget things now and then. Maybe you walk into the kitchen and can't remember why, or you lose track of where you put your glasses. Most of the time, that's just normal aging. But here's the surprising truth. Some memory changes are different. They're not just little slips of the mind. They can be early signals that the brain needs extra attention. And the sooner we recognize them, the better chance we have to protect our independence, our confidence, and our quality of life. Today, I'm going to walk you through 10 of these early signs, and for each one, I'll give you a simple, practical tip you can use right away to keep your memory sharp. By the end, you'll know how to tell the difference between a harmless memory lapse and a warning that deserves a closer look.
Now, before we dive into the list, let's clear up something really important. Dementia is not a normal part of aging. Getting older doesn't automatically mean losing your memory or your independence. We all have moments where we forget a name or misplace our phone, and then a little later it comes back to us. That's normal aging. The brain is still working, it just needs an extra second to catch up. But dementia is different. The memory slips are frequent, they don't correct themselves, and they start to interfere with everyday life. That's when we need to pay attention. And here's another key point. These warning signs don't always mean dementia. Stress, certain medications, sleep problems, even infections, all of these can look very similar. That's why noticing patterns early is so valuable. It gives doctors the chance to rule out the simple causes and act quickly if it's something more serious. So as we go through the 10 signs, keep this in mind. One slip now and then is usually no big deal. But if you see several of these signs showing up often, that's the time to check in with a professional.
One of the very first changes people notice is short-term memory loss. And here's what that looks like in real life. You might forget the details of a conversation you just had with your daughter. Or maybe you prepare lunch, eat it, and an hour later you ask, "So, what's for lunch today?" That's different from forgetting where you left your glasses. Because in dementia, it's the recent events that slip away, while older memories often stay intact. Another clue is repetition. Someone may ask the same question again and again, not realizing they've already asked it. Now, what can you do if you notice this in yourself or a loved one? One simple step is to keep a small notebook or use your phone as a memory helper. Write down appointments, meals, or conversations you want to remember. This won't prevent dementia, but it gives you a way to stay independent, and it also helps you notice if the memory slips are becoming more frequent. The key difference is this. With normal aging, the memory usually comes back later. With dementia, it doesn't. And when those recent memories vanish again and again, it's a sign the brain may need extra care.
Another early sign is repeating the same stories or the same questions, sometimes within the very same conversation. Picture this. You're sitting at the dinner table, and the loved one tells the story about their first car. Everyone smiles politely, but a few minutes later, they start telling that exact same story again. Or they might ask, "What day is the doctor's appointment?" and then ask the same thing 10 minutes later. Now, of course, we've all told the same story twice, maybe because we're excited or we forgot who we told it to. That's normal. What makes dementia different is when it happens often and the person truly doesn't remember that they already said it. So what can you do? If you notice this pattern, try gently keeping track of how often it happens. Families sometimes use a little logbook or even jot it down on their phone. It's not about blaming or correcting, it's about spotting a change that might need more attention. And here's the hopeful part. Catching this early can make a huge difference. It gives doctors the chance to check for other causes, like thyroid issues, medication side effects, even sleep apnea. And sometimes those are problems that can be treated.
One of the most reliable early signs is having trouble with tasks that used to feel easy, especially the ones that require several steps. Maybe someone who has always balanced the checkbook now struggles to keep the numbers straight, or a person who's cooked the same family recipe for 30 years suddenly can't remember the order of the ingredients. Even something like managing daily medications can become confusing with doses skipped or repeated. Now, everyone makes mistakes from time to time. We've all burned a meal or forgotten to pay a bill once. The difference here is that these slip-ups happen more often and in tasks that were second nature before. If you notice this, one helpful step is to simplify routines. Break bigger tasks into smaller steps and write them down. For medications, a pill organizer can take away a lot of stress. And just like with the other signs, keeping an eye on how often it happens will give you and your doctor a clearer picture. The good news? Sometimes these struggles are not dementia at all. They can come from fatigue, stress, or even vision problems, but spotting them early gives you the chance to find out what's really going on.
Another early sign is getting mixed up about time and place. It can start small, like forgetting what day of the week it is. We've all woken up and thought it was Wednesday when it was actually Thursday. That's normal, and usually we figure it out pretty quickly. But with dementia, the confusion can go further. Someone might lose track of the season, the year, or even where they are. A person may be walking in their own neighborhood and suddenly feel lost, unsure how to get home. Or they might arrive at a familiar friend's house and not recognize the street. If you notice this, one simple tip is to keep calendars and clocks clearly visible around the house. Some people use digital clocks that show the day, date, and time all in one. But remember, if disorientation happens often or in places that should feel familiar, it's time to check in with a doctor. And here's the hopeful part. Sometimes these problems come from things like poor sleep or even medication side effects, both of which can be fixed. The key is catching the pattern early, before it starts to limit independence.
Let's talk about language. We all forget a word now and then. It's on the tip of the tongue, and later it pops back into our mind. That's a normal part of aging. But with dementia, the struggle is different. A person might stop in the middle of a sentence and not be able to finish it. Or they might use vague phrases like, the thing you sit on, instead of saying chair. Over time, their vocabulary can shrink, and conversations can become frustrating for both them and the people around them. Here's one simple tip. Keep the brain active with words. Reading out loud, doing crossword puzzles, or even singing along to favorite songs can help keep language skills sharper. And if you notice these pauses and substitutions happening often, it's worth getting it checked out. The important thing to remember is this: occasional word-finding problems are normal, but when everyday communication becomes a struggle, that's when it may signal something more.
Another sign to watch for is trouble with vision and spatial awareness. Now, needing stronger glasses as we age is perfectly normal, but dementia can affect how the brain processes what the eyes are seeing. That means someone might misjudge distances when driving, have trouble parking the car, or bump into furniture more often. Reading numbers, colors, or symbols can also become confusing, even if their eyesight is otherwise fine. One helpful step is to make the home environment as safe and clear as possible. Good lighting in hallways, removing clutter, and using contrasting colors to make objects easier to see. And of course, regular eye exams are important to rule out vision problems first. The key difference is this: with regular vision issues, new glasses usually solve the problem. With dementia, the mistakes keep happening because it's the brain, not just the eyes, that's struggling.
We've all lost our keys or the TV remote. That's just life. Usually after a little searching, we remember where we left them. But with dementia, it's different. Objects often end up in places that make no sense, like putting the remote control in the refrigerator or leaving a wallet inside the bathroom cabinet. And the bigger concern is that the person can't retrace their steps to find the item again. Sometimes, when this happens often, the person may even start accusing others of stealing. That can be very stressful for families because it feels personal when really it's the brain trying to make sense of the confusion. If you notice this, one practical tip is to create home bases for important items. A specific bowl for keys, a fixed spot for the phone, a drawer just for the wallet. This makes it easier for everyone, and it can also help you see if the misplacing is becoming a pattern. The important difference is this: a misplaced object now and then is normal, but when it happens often,
in odd places, and without the ability to retrace their steps, that's when it may be a red flag.
One more early sign is changes in judgment. We all make a questionable decision from time to time. Maybe we buy something we don't need, or we forget to lock the front door once in a while. That's human. But with dementia, the choices can be very different from someone's usual behavior. A person might start giving away large amounts of money to strangers on the phone, ignoring obvious safety risks, or neglecting personal hygiene in ways that are completely out of character. If you see this happening, one helpful step is to create gentle safety nets. For example, set up automatic bill payments to avoid missed expenses, or use caller ID to filter unknown numbers. And if hygiene is becoming a concern, simple reminders and supportive routines can help without making the person feel embarrassed. The key point is this: when everyday judgment suddenly changes, especially with money, safety, or self-care, it may be more than just a slip. It could be the brain sending the signal that something's not right.
Another early change we often see is stepping back from social life. Now, everyone needs downtime. After 60, many of us enjoy a little more peace and quiet, and that's perfectly normal. But with dementia, the withdrawal can go further. A person who once loved playing cards with friends might stop showing up. Someone who always attended church or community events may begin making excuses to stay home. Sometimes it's because they feel embarrassed by memory slips or anxious that they won't follow conversations. Over time, this can lead to real isolation. If you notice this happening, one gentle step is to encourage small, low-pressure connections. A short phone call with a friend, a walk with a neighbor, or even a video chat with family can make a big difference. The goal isn't to push, it's to keep those social ties alive, because staying connected is one of the best ways to support both mood and memory. The difference here is that choosing quiet time is normal, but losing interest in people and activities they once loved, that's a signal to look closer. One of the most difficult changes for families to notice is a shift in mood or personality. Now, everyone has a bad day now and then. We all get frustrated, tired, or a little irritable. That's part of being human. But with dementia, the changes can feel more sudden and very different from the person's usual self. Someone who was always patient may become quick to anger. A normally outgoing person may grow anxious or suspicious. Families often say, "He just doesn't seem like himself anymore." If you notice this, one helpful step is to respond with reassurance instead of confrontation. Try to keep routines calm and predictable, and if a loved one feels anxious, gently redirect the focus to something comforting, like listening to familiar music or looking at old family photos. The important thing to remember is this: occasional mood swings happen to everyone. But when personality shifts become stronger, more frequent, and start changing relationships, that's a clear sign it deserves medical attention.
Alongside the 10 common early signs, there are a few other changes that can appear in some people. These aren't always present, but when they are, they deserve special attention. One is a lack of awareness of the problem itself, what doctors call loss of insight. A person may insist there's nothing wrong, even when memory problems are clear to everyone around them. Another is the development of false beliefs or delusions. For example, someone may become convinced that a neighbor is stealing from them or that their food is being poisoned. Hallucinations can also appear, especially visual ones. A person might see people or animals that aren't really there. And finally, there can be disinhibition, behaviors or comments that are out of character and socially inappropriate, like saying things they never would have before. Now, these symptoms don't happen in every case, but when they do, they can be very upsetting for families. The important takeaway is this: if you notice any of these changes, it's time to seek medical help right away. Doctors can guide you towards support, treatment, and safety measures to help everyone involved.
Let's take a moment to pull everything together. First, dementia is not a normal part of aging. Occasional forgetfulness happens to all of us. That's normal aging. You might forget a name, but it comes back later. You might walk into a room and wonder why you went there, and then remember a few minutes later. That's everyday life. What makes dementia different
is when memory slips or other changes keep happening, and they begin to interfere with daily routines, cooking, driving, managing money, or keeping up with conversations. The difference is not just the forgetfulness itself, but the frequency, the impact, and the fact that the memory doesn't come back. Another key point. Many of the signs we talked about can also be caused by other things: stress, sleep problems, medication side effects, even infections. That's why it's so important not to panic, but to notice patterns and share them with a doctor. And here is the hopeful message. The earlier these changes are recognized, the more options there are for support, for treatment, and for planning ahead. Early awareness doesn't take away independence, it protects it. So here's the bottom line. Growing older does not mean losing yourself. Yes, our brains change with age, but that doesn't automatically lead to dementia. By watching for these early signs and by acting on them, we give ourselves and our loved ones the best chance to stay independent, connected, and strong. And remember, even if some of these signs show up, there are many ways to support the brain through healthy habits, medical care, and the love and patience of family and friends. Now, I'd love to hear from you. Have you noticed any of these changes in yourself or in someone close to you? Share your thoughts in the comments. Your story might help someone else who's watching right now. And if you found this video helpful, consider subscribing, because every week we explore practical ways to stay healthy, active, and confident after 50. Take care of yourself, and I'll see you in the next one.